everyone, I'm Amaya and today I'm here with Dr. Prashant Bafna, a renowned rheumatologist with extensive experience in treating rheumatic conditions.
Hello everyone. Hi.
Hi doctor, welcome to the talk. And today's topic is one that affects millions of people worldwide, a common myth and concerns surrounding rheumatic conditions. So let's start by addressing some of the myths that swirl around rheumatic conditions. One prevalent myth being only the elderly people are susceptible to these conditions. What is your opinion on this, doctor?
It's a myth. Why? Because it's not only the elderly population, even children, middle-aged women and men can also have this arthritis. So in children, if we call it a juvenile arthritis, and actually the most common age which affects is the middle age, between the 20 to 40 years of age. Why? Because these patients, particularly in women, because of the hormonal changes. The elderly population which they suffer arthritis is usually as a degenerative arthritis, like osteoarthritis of the knees. They can also have an inflammatory arthritis like rheumatoid arthritis, psoriatic arthritis, etc. But it's a myth that the elderly population only have an arthritis.
Okay, that's enlightening. Another myth we often hear is that cold weather causes arthritis. Uh, could you provide some insight into the relationship between weather and rheumatic conditions and specifically rheumatic arthritis pain?
Okay, so cold doesn't cause arthritis, but cold can trigger a patient who has already an arthritis. For example, a rheumatoid arthritis or an psoriatic arthritis patient who's on medicine and they were under control like while on medicine, but in presence of cold it can trigger and cause increased pain, particularly in those joints which were previously involved. So cold doesn't cause arthritis, it can trigger arthritis. So many of them patient thinks that cold is the reason for the arthritis, and as summer comes it improves. But this what does that causes is like they don't allow them to go to a doctor. But these patients has to be treated early even if they have disease only during cold, because on long term these two diseases which I spoke about, the rheumatoid and psoriatic arthritis, can cause destruction of the joints and cause deformity.
All right. Thank you so much for clarifying that. Now let's address the misconception that all joint pain is a sign of arthritis. What is the reality behind this, doctor?
Yeah, so not all joints pain are the cause for the arthritis. So for example, if you have a pain with or without swelling, and the pain is more at night when you sleep or when you get up in the morning, and that pain or stiffness or the pain associated with stiffness lasting for more than half an hour, they are an arthritis. But if you have a pain non-specific site, like you have a arm pain, you have upper neck pain, lower back pain, which was during activity, so those are possibly not due to arthritis. So for this we need to go to a rheumatologist, because they have to take a detailed history to find out what is the cause for your pain. That's it.
I appreciate you highlighting that, doctor. Moving on, there is a belief that dietary supplements can cure arthritis. Could you help us understand the role of supplements in managing rheumatic conditions?
Yeah, that's a very nice question. Many of the patient, first thing they ask is the diet. Yeah, so diet doesn't cure arthritis, but diet supports you to relieve your pain in patients suffering with arthritis. For example, what diet you have to take? Diet rich in omega-3 fatty acids like flax seeds, soya, nuts, green leafy vegetables, and if you eat non-veg, fish oil as maximum omega-3 fatty acids. So these, what studies have shown is taking these type of diet improves your joints pain. And other important thing is diet rich in dietary fibers and reduced carb, for example rice and all. If you eat more of dietary fibers and reduce your carb intake, it also helps in improving the arthritis. Other thing is, see, not all diet we can do a study. So if a patient complains that if I take that particular diet a day before and next day have a severe pain, so that possibly a reason for your pain, increased pain the next day. So we recommend that to stop those diet which increase your pain.
All right, that is a very wise advice, doctor. Now another myth that I have come across is that rheumatic conditions are not serious health issues. Could you provide some insight into the potential impact of these conditions on overall health and well-being?
Yes, so this myth, what happened is, because of this myth, majority of patients don't land up to a rheumatologist. They neglect those symptoms and they come to us when it's very severe. For example, if it is a rheumatoid psoriatic arthritis, when they develop a deformity or they develop so much of swelling that they are not able to get cured with a single medicine like painkiller from the over the counter drugs. So that is an destructive arthritis. You need to treat them early. There are other form of arthritis, for example connective tissue disorder like lupus, systemic sclerosis. They can just present with skin like facial rash, oral ulcer, but they may have serious internal organ involvement like lung involvement, kidney involvement. And there is other group called vasculitis. So they can just present with an ulcer. They may have a severe kidney problem, the severe lung problem. So arthritis is not a simple thing. It can be serious if you have some particular type of arthritis.
All right. Thank you, doctor.
Thank you
for debunking these myths. Now let's address some common concerns that individuals often have about rheumatic conditions. One is the fear of disability and loss of independence. How can people cope with this worry?
So yeah, so as I said my previous question, if you delay in going to a doctor and if you delay in getting a treatment, appropriate treatment, that is where it causes destruction. So earlier, some 15-20 years ago, there were not much of medicines. So patient unfortunately has to go to that deformity and all. But nowadays there are such a good medicines and various different modalities of treatment to improve that disability. So if you come early to a doctor, get an appropriate treatment, you can prevent your deformity and disability.
All right. I'm glad you brought up, recent medications and all coming up, because that was my next concern. Another concern is the limited treatment options available for rheumatic conditions.
Yes, so this was a reality before around 20 years back. But now it is a myth. Why? Because there are not limited options. There are several options available. So like we have a conventional disease modifying agent. So we treat any autoimmune inflammatory disease by us called as DMARDs, that is disease modifying anti-rheumatic drugs. So there are conventional treatments which many of them know like methotrexate, leflunomide, hydroxychloroquine, etc. There are, if the patient doesn't respond to those conventional treatment, there are different like target therapies like tofacitinib, baricitinib, etc. If you don't respond to them also, there is a different modality of treatment called biologics. So if you don't respond to a first line of medicine, that doesn't mean that you are not responding. It means that possibly the disease is so severe that this conventional treatment is not working. So you have to go to a doctor again, explain that you are not getting relieved. They'll explain definitely the different advanced modality of treatment.
All right. That is reassuring to hear, doctor. Now let's move on to the concerns about the impact of rheumatic conditions on a daily life. How can individuals continue to engage in their favorite activities while managing their condition?
Okay, so because autoimmune disorders are chronic disorders, so not only they get limited because of the pain, they also bogged with the mental problems associated with this arthritis. For example, if a patient has a pain which is more at worst at night and in the morning, so obviously that affect their sleep, and whole day they have to work. For example, a woman or man doing a job, the whole day they have to work, and when at night they want to take a rest, they can't take because that is the time where joint get flared up.
Yeah.
So this can cause a chronic mental issues, and various patients go to a depression also. So how to cope up with this is, the problem here is the arthritis. Go to a doctor, rheumatologist, they will treat you on arthritis. Once this is get controlled, the other mental issues can also be get solved first by improving the arthritis. Plus you also need to do a physical exercise. That is also very much important because long standing arthritis would have affected your joint and the ligament associated. So if you have active physical exercise, it will improve your joint mobility and the muscle strength around it. And other important is the diet, which I have told you. So if you have a combination of proper diet, healthy habits, regular exercise and regular and appropriate medicine, it can cope up with a normal life like all we others with non-rheumatic diseases or with normal person lives.
All right. Thank you so much for those practical suggestions, doctor. Now lastly, for those who suspect that they might have a rheumatic condition or has already been diagnosed with rheumatic conditions, what advice would you offer them to take control of their situation?
Okay, so if first of all you need to confirm whether your arthritis is confirmed to have an arthritis or not, because many of them have some mild joint pain which may not be typical of an arthritis. They get a blood test done and they found that there is some abnormality in ANA, RA factor, because everything available in YouTube now, or not YouTube, in the Google now. So you have to go to a rheumatologist and confirm you have an arthritis first. If you have an arthritis, just confirm what type of arthritis. After confirming type of arthritis, you also have to tell your doctor that what is your future plan. For example, many of these patients I told you, it's in 20 to 40 years of age who have this type of arthritis, and these are particularly the women of childbearing age. So there are some medicine what we give that had not to be taken during pregnancy. So if you are planning a pregnancy, you need to tell that. So this is a very important topic, medicine in pregnancy. This has to be stopped 6 months to 3 months prior, and that there are some medicines which we give which are compatible to pregnancy. So this is one take up point. The second take up point is whenever you have an arthritis confirmed, you have to be taken on medicine, and those have to be monitored. So for example, not all patients tolerate those medicines. If you have an issue with the medicine, go to a doctor again and tell them that this have an issue with this medicine. They will change the modality of treatment. So this is a second thing is follow up, and is any autoimmune disease is not a short term follow, it's a long term follow. So many of the doctors will call you at monthly follow up for an initial 2 to 3 visit. Then you are tolerating it well, the disease is under control. Then we call once in 3 to 4 months for the follow up.
Alright. Thank you so much,
Thank you
Dr.
so much.
Prashant, for your time. Your expertise has been invaluable, and I'm sure our listeners have gained a deeper understanding today. Thank you so much.
Thank you so
Doctor.
much. Thank you everyone.
Thank you.